I know, right?
We haven't
I'm
even
going to
started
reclaim my
yet.
time, thank you.
Okay, I think it's.
Oh, tilt.
I don't know.
Yeah, tilt.
Try that.
Thank you.
I was trying to be helpful.
I'm actually not all that. Good afternoon. Thank you again. My name is Ace Robinson. I'm the Director of Strategic Partnerships in NMAC, or at NMAC, the National Minority AIDS Council. And I want to thank PACHA and the federal partners for this opportunity to speak about the needs of the communities that are disproportionately impacted by HIV. I think we know by our data, we're speaking specifically about Black, Latinx, American Native, LGBTQ+ populations, Black and Latina, cisgender, heterosexual women, people who are using drugs, and street-involved / homeless individuals. And we know from like the mountains of qualitative data, HIV surveillance data, and most importantly, from the lived experiences of people living with HIV in the communities that are disproportionately impacted by HIV, what needs to be done. And we don't really have to keep trying to reinvent the wheel when the roadmap has been laid out, and it's time for us to follow it. So I would say that this goes without saying, but it must be said again and again until we actually see change. As we are creating, and not after, similar to what Member John Zapiro said, that as we're creating these local, regional, and national plans, that the community needs to be at the center of these conversations, that they need to be driving these conversations and creating them and moving them forward. We cannot allow for those of us who are sitting in this room to create a plan and then ask for advice, as opposed to them creating a plan and then them coming to us and ask for advice if they deem it to be appropriate. And all these activities that are executed must be through the lens of those high burden communities, because as we know, we can't keep putting all this work in and then expecting a different result by doing the same thing that we did before that has kept us in these same conversations since 1981. So in September of this year, just for the United States Conference on AIDS, we got the health departments together from the 57 jurisdictions, and over 40 of the jurisdictions attended. There were 3 themes that I want to make sure that we share. That communication is necessary, the need for less structured, like webinar style communication. That community engagement is going to look different, especially from the jurisdictions that have not had the resources to do this in the past. And that the guidance needs to be timely, as we've seen that the dates for the final submissions have not changed that much, but the community is asking, or the administrators are asking for more timely guidance to make sure they're doing things in an appropriate manner. And then finally, and it's important that we talk about the changing systems that have ingrained health disparities for impacted populations. Dimitri Doskalatzis, he's the Associate Commissioner at the New York City Department of Health and Mental Hygiene. One second. He said that we have achieved 90-90-90, what Dr. Harris is speaking about. We have achieved 90-90-90 in white populations, and the non-white populations we have failed. So we need to be very clear that we're talking about that we have to change our structural systems. Earlier, for example, we learned about the PrEP donation community awareness rollout coming from a particular organization. And then I think some of us were sitting here, we were looking at the website, and we saw that there were apparently 0 Black people in that organization. But we also know from all the data that Black people have the highest level of disparity when it comes to PrEP uptake. So if we're going to be reaching out to these organizations to do this work, we need to push this forward. And earlier, I think to end off, earlier, and Tegni Dempsey of HRSA stated that people don't come back for good reasons, and that we need to adjust our clinical systems to better serve these populations. So I'm going to ask that everyone look in the mirror at the work that we're doing, and if that mirror is a little bit foggy, take some community center Windex, clean it, and start it out. Thank you.